CEN test prep exam final. Question 1. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is: Option A, absent breath sounds. Option B, a dullness to percussion on the affected side. Option C, a tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, dullness to percussion on the affected side. Question 2. What is the priority intervention for a patient with an open fracture? Option A, immediate surgical debridement. Option B, apply traction. Option C, cover the wound with a sterile saline minus moistened dressing and immobilize. Option D, administer analgesics. The correct answer is option C, cover the wound with a sterile saline minus moistened dressing and immobilize. Question 3. A patient with a spinal cord injury at T1 is bradycardic and hypotensive. This is characteristic of: Option A, hemorrhagic shock. Option B, cardiogenic shock. Option C, neurogenic shock. Option D, septic shock. The correct answer is option C, neurogenic shock. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is: Option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotality. The correct answer is option D, administration of antivenom, crotality. Question 5. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with: Option A, a scalp laceration. Option B, an orbital wall blowout fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Question 6. A female patient of childbearing age with abdominal pain should always be evaluated for: Option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Question 7. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A, the EtCO2 of 0 mmHg. Option B, persistent EtCO2 waveform with each ventilation. Option C, PtCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent EtCO2 waveform with each ventilation. Question 8. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects: Option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects: Option A, cystitis. Option B, pyelonephritis. Option C, nephrolithiasis. Option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Question 10. Hepatitis A is primarily transmitted via: Option A, blood and body fluids. Option B, fecal minus oral route. Option C, sexual contact. Option D, contaminated needles. The correct answer is option B, fecal minus oral route. Question 11. Sengstaken minus Blakemore tube placement is used as a temporizing measure for bleeding from: Option A, peptic ulcer. Option B, esophageal varices. Option C, diverticulosis. Option D, aortoenteric fistula. The correct answer is option B, esophageal varices. Question 12. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Question 13. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils. Option B, a unilaterally dilated and fixed pupil. Option C, bilateral mid- position and fixed pupils. Option D, a constricted, sluggishly reactive pupils. The correct answer is option B, a unilaterally dilated and fixed pupil. Question 14. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option A, hyperkalemia. Option B, hypercalcemia. Option C, hypocalcemia. Option D, hypermagnesemia. The correct answer is option C, hypocalcemia. Question 15. A Call's fracture involves the option A, proximal humerus. Option B, distal radius. Option C, femoral neck. Option D, tibial plateau. The correct answer is option B, distal radius. Question 16. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option B, keep the patient NPO and provide aggressive fluid resuscitation. Question 17. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. Question 18. A patient with a suspected spinal cord injury develops hypotension and bradycardia. The nurse suspects option A, hemorrhagic shock. Option B, neurogenic shock. Option C, cardiogenic shock. Option D, anaphylactic shock. The correct answer is option B, neurogenic shock. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Which assessment finding is consistent with a flail chest? Option A, a crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, a tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Question 20. Ovarian torsion presents with option A, bilateral lower quadrant pain. Option B, a sudden, severe unilateral lower abdominal pain with nausea. Option C, painless vaginal bleeding. Option D, a fever and purulent discharge. The correct answer is option B, sudden, severe unilateral lower abdominal pain with nausea. Question 21. The most common cause of lower gastrointestinal bleeding in adults is option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss tear. The correct answer is option B, diverticulosis. Question 22. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A, a patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, a surgery on the wrong body part. Option D, an AMA discharge. The correct answer is option C, surgery on the wrong body part. Question 23. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, the immediate endotracheal intubation. Option D, a neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. Question 24. A hyphema involves option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 25. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management.